Down syndrome. Down syndrome is a condition in which a person has an extra chromosome. Chromosomes are small packages of genes in the body. They determine how a baby's body forms during pregnancy and how the baby's body functions as it grows in the womb and after birth. Typically, a baby is born with 46 chromosomes. Babies with Down syndrome have an extra copy of one of these chromosomes, chromosome 21. Types of Down syndrome: trisomy 21, 95%; translocation Down syndrome 3%; mosaic Down syndrome 2%. So three types of Down syndrome: trisomy 21, translocation Down syndrome, mosaic Down syndrome. Risk factors: advancing maternal age, usually women of age 35 and above; mothers who already have one child with Down syndrome; parents who are carriers of the genetic translocation for Down syndrome. Clinical features: head and neck brachycephaly, upslanting palpebral fissure, epicanthal folds, brush-field spots, flat nasal bridge, folded or dysplastic ears, open mouth, protruding tongue, short neck, excessive skin at the nape of neck, extremities, short broad hands, short fifth finger, incurved fifth finger, transverse palmar crease, space between first and second toe. So head and neck, brachycephaly, upslanting palpebral fissures, epicanthal folds, brush-field spots, flat nasal bridge, folded or dysplastic ears, open mouth, protruding tongue, short neck, excessive skin at the nape of neck, in extremity, short broad hands, short fifth finger, incurved fifth finger, transverse palmar crease, space between first and second toe. Decreased muscle strength, hypertonia, hyperflexibility, joint laxity, vitamin D deficiency, decreased bone mineral density. Flattened nasal bridge, epicanthal folds, brush-field spots. Simian crease, normal palm creases. Other health-related problems: cardiovascular problems, ventricle septal defect, atrial septal defect, patent ductus arteriosus; endocrine problems, thyroid problems, diabetes mellitus; gastrointestinal problems, duodenal, esophageal and anal atresia, Hirschsprung's disease; hematological problems, acute leukemia, transient proliferative disease; neurological problems, epilepsy, severe behavioral problems, Alzheimer's, memory problems. Other problems: sleep problems, sleep apnea, other sleep disturbances, skeletal problems, flat foot, atlantoaxial subluxation; visual problems, refractive disorder, squint, nystagmus; hearing problems, hearing loss, conductive hearing loss, chronic otitis media; obesity and nutrient deficiency, malabsorption, properly linked with celiac disease due to intestinal damage. Some has lack of vitamin B12, folic acid and zinc, need for antioxidants, that is vitamin E. Diagnosis: prenatal screening, ultrasound, blood test, biochemical test, maternal serum screening; diagnostic test, amniocentesis, Willis sampling. Management: growth measurements should be plotted on the appropriate growth chart for children with Down syndrome. This will help in prevention of obesity and early diagnosis of celiac disease and hypothyroidism. Cardiac diseases: all newborns should be evaluated by cardiac echo and CHD in consultation with pediatric cardiologist. Hearing: screening to be done in the newborn period, every 6 months until 3 years of age, and then annually. Eye disorders: an eye exam should be performed in the newborn period or at least before 6 months of age to detect strabismus, nystagmus and cataracts. Thyroid function: should be done in newborn period and should be repeated at 6 and 12 months and then annually. Celiac disease screening should begin at 2 years. Repeat screening as signs develop. Hematology CBC with DLC at birth to evaluate for polycythemia as well as leukemia. Atlantoaxial instability. X-ray for evidence of atlantoaxial instability or subluxation at 3 to 5 years of age. Alzheimer's disease. Adult with a Down syndrome has earlier onset of symptoms when diagnosis is considered. Thyroid disease and possible depression should be excluded. Physiotherapy. Goals of PT: minimize the development of compensatory movements pattern that children with Down syndrome are prone to develop. Promote achievement of gross motor skills such as sitting, crawling, and standing. Improve independence in functional activities. Improve muscle strength, posture, and balance. Improve confidence and socialization with peers through improved motor skills. Reduce the risk of secondary joint problems in later life as a result of lax ligaments. Improving core stability, sitting on a ball, prone on the ball, prone on boards. Sitting on the ball, hold the pelvis, rock forward and backward and side to side. Play games to encourage your child to reach outside their base support. Catch or throw in this position. Supermans. Play Supermans. Fly up, up, and away. Start with the ball full under the chest. Progress to only having the ball under the hips or thighs. Balance training. Walking forward, backward, sideways. Stand on one leg. Walking along different surfaces, example pillows, foam mattress. Stepping up and down. Walking on toes and heels. Gait training, treadmill training, gait mat training, obstacles walking. Strengthening muscles, maintaining good posture, postural correction exercises, play therapy, assistive and adaptive devices, skill development. Life expectations. The typical life expectancy of people with Down syndrome has nearly doubled in recent decades from 25 years to 49 years. About 13% of people with Down syndrome live longer than 68 years.